If you're struggling with hip bursitis or lateral hip pain, I have a great video for you today. Join me today as I walk you through exercises and strategies to help you with your pain. Here we go. Hip bursitis occurs when one or more of the bursa in the hip becomes inflamed, leading to discomfort and pain. The most common hip bursitis affects the bursa over the greater trochanter, or the bony prominence on the outside of the hip. And if you're having symptoms of tenderness and pain on the outside of your hip, and difficulty laying on your side at night sleeping, you may be dealing with hip bursitis. And more recent research has found that hip bursitis is rarely isolated. Usually there's changes in the muscles on the outside of the hip, leading to increased tenderness and pain. And today we're going to focus on specific exercises you can do at home that will target those hip muscles to improve your flexibility and improve your strength that will help relieve your symptoms. Let's get to it. The number one muscle we want to strengthen is the gluteus medius muscle, or the muscle running along the outside of the hip. To do this, we're going to perform hip abduction or leg raises laying on our side. So laying on your side, the top leg is going to be the one we're going to strengthen. Bottom leg is bent. We're going to work on lifting that leg up towards the ceiling and then controlling back down. Keeping that hip slightly rotated forward as we lift that leg up towards the ceiling, feeling that muscle burn and fatigue on the outside of the hip. Continue with that one up to 2 to 3 sets with 10 repetitions to improve that strength in the gluteus medius muscle to help relieve your symptoms. The second strengthening exercise, we're going to perform bridges laying on our back to target muscles on the back of the hip. Laying on your back with your knees bent up, you're going to squeeze your bottom and push up towards the ceiling until your hips and knees are in a straight line. You're going to hold that position 5 seconds and then control back down. Focus on slow and controlled movement as you squeeze your glutes, push up towards the ceiling. Continue with this one with that 5-second hold for 15 repetitions to start to improve that glute strength. For our third strengthening exercise, we're going to go back to the sideline position to perform clamshells. With this one, you can start without resistance and then progress to adding a resistance band to further improve your strength on the outside of your hip. So for the clamshell exercise, you're going to have both legs bent up, 90-degree position. Keeping your feet together, you're going to lift that top leg up towards the ceiling. Keep that hip rotated forward as you lift up towards the ceiling, pausing at the top, and then control back down. With this one, you can start with 10 reps, 2 to 3 sets. As this one gets easier, you can add that resistance band right above your knees to further improve that strength on the outside of your hip. Same idea with the resistance band, pulling up towards the ceiling, pausing at the top, and then controlling back down. Feeling that muscle burn and fatigue on the outside of the hip to improve that strength to help you with your pain. Next, we're going to move on to some stretches to help improve flexibility in your hip. The first stretch we're going to perform, laying on your back, we're going to target the outside of the hip, bringing your leg up and over onto your knee. You're going to pull your knee to your opposite shoulder until you feel that stretch on the back of the hip. Hold that position 30 seconds, relax, and then perform 3 sets of 30 seconds to improve that flexibility on the back of the hip. For our second stretch, we're going to perform laying on our back to improve flexibility in the front of the hip. So laying on your back, you're going to pull one leg up towards your chest, drop that opposite leg off the edge of the table or off the edge of the bed. Feel that stretch on the front of the hip. Hold that position 30 seconds and then relax. Perform this 3 times, 30 seconds each to improve that flexibility in the front of your hip to help you with your pain. The third stretch we're going to perform today in the seated position, we're going to do a hamstring stretch. In a chair, you're going to scoot forward to the edge of the chair. One leg you're going to put out straight. That's the leg you're going to stretch. Sitting up nice and tall, you're going to lean forward, keeping your back straight until you feel a stretch on the back of the leg. Head and chest up, lean forward until you feel that stretch. Hold that position 30 seconds. Perform 3 sets of 30 seconds to improve that flexibility in the hamstrings and the back of the leg. Thanks for watching today. Perform these exercises to help treat your hip bursitis or lateral hip pain. If you found today's video helpful, click that like button and comment below, and I'll see you in the next video. I'm Dr. Josa, helping you to move better and feel better.